welcome to Prague. I spend my summers here, or my winters here, and my winters in Florida rather, and my summers here in Prague. I'm married to a Czech, who I call my Czech mate. And as I was watching the different speakers, I'm not sure, but I may be the only non-nurse that you have. Is that true? Are all the other speakers nurses?
I think so, yes.
Okay. So here I am, a social worker. And if you're wondering what in the world a social worker is doing talking at a nursing conference, I will say thank you for asking. And I will also tell you that the program that I'm going to talk about this evening would not have happened without nursing support. If I didn't have the charge nurse in Bennington, Vermont, who said, yes, I want you to do this. If I didn't have the charge nurse on the unit say, yes, I want you to do this, Namaste wouldn't have happened. So from a nursing perspective, I hope that you're going to look at this as seeing how can I help people, especially those with advanced dementia, live, not just exist. So a little bit about myself. I was born and brought up in Concord, New Hampshire. And I was told I wasn't smart enough to go to college. So I was a good Catholic girl and I got married and had babies. And then I had foster babies and I had more children than you can imagine. I used to get a baby every 6 weeks and keep them until they were adopted. And then my kids all went to school. And I'm thinking, what am I going to do? And so I decided to go to school. And I was so fortunate to go to a community college where I walked in and said, I was told I wasn't smart enough to go to college, but do you think that you have any classes I could take to prepare? And absolutely, they invited me in and I did actually graduate and it was lovely. I went back to the woman who had first opened the door of college for me all those years ago. And I showed her my diploma and I had a 4.0 average. Woo! And I became a social worker. And as you could see, it was a long time ago. And when I started as a social worker, most of the residents in long-term care were alert and oriented. And I could actually do social work groups. So I could have, I had a discharge planning group. So that were people who had gone through rehabilitation and were getting ready to go home. And then I had a family support group because mom was coming home and now, what did I expect? What was I going to do with mom? So I was really, in fact, loving my social work job in a long-term care setting. And then I realized that the majority of the residents had some type of memory problems. So obviously counseling wasn't important anymore. But as I was walking through the nursing home and looking at the residents, I realized that if they were engaged in an activity, they were happy. And obviously that was one of my goals as a social worker, was to help people adjust to living in a nursing home, and they were happy. And so activities were working. And so I use this quote from Robert Frost. I took the road less traveled, and that has made all the difference. So as a social worker, I ended up developing activity programs for people with very early memory loss and people who didn't have memory loss at all. And at that time, I was so fortunate. The business of owning nursing homes had just started. And these companies were starting. One I was with for 3 years, and it started with 300 homes. And when I ended, they had 3,000 homes. So it was big business. And I flew all over the country teaching about activity programs. And I was just having a great time. And I hope you'll appreciate this story. I was speaking in Vermont at an activity conference. And after I finished speaking, a young woman walked up to me and she said, by any chance, do you consult? And I said, no, I have a job. I'm working for a blah, blah, blah company. And why do you ask? And she said, well, I've been just given the responsibility of developing a dementia program, and I don't have a clue what to do. And I said, well, give me your business card, and who knows, I may be able to give you a call or talk to you on the phone. That was on a Saturday. On Monday, my boss called me into the office and he said, I don't know how to tell you this, Joyce, but we're going bankrupt. You need to look for a new job. Your last day is Friday. And I thought, woo, I had a business card. This is so cool. I'm going to have a job immediately at this nursing home in Bennington, Vermont. So I called her back and we made the plans for me to come and consult. And about 2 days before I was to go there, her boss called her into his office and he said, I've just looked at the budget and we don't have any money to pay for a consultant. So I'll pay for her hotel, but see if she'll come as a volunteer. So my very first job as a consultant, I did for free. And I ended up in Bennington, Vermont at the Vermont Veterans Home. And what I realized was that the residents with dementia really very rarely initiated any kind of activity. And this is when they were wandering around, and of course that's when they were fall. Many of them just slept all day, and so they were awake at 2 or 3 in the morning, and so they were giving sleeping pills in the middle of the night, and they were depressed. And it made me so sad to see them. And I realized that, like Walter, who is the double PhD, got up in the morning, got dressed, had breakfast, and then they sat him in front of a TV set. And of course, he could care less what was on the television. And I thought, Walter doesn't really have a reason to get up every day. What if I developed a program that started as soon as the residents finished breakfast and gave them a job? So here's Walter. And we had 3 decks of cards, and they all had very different designs on them. And when Walter woke up in the morning, we educated the caregivers to say, Walter, it's time to get up and get dressed because your friends are waiting for you in the club. And I called it the club because it was an officers' nursing home. So they either belonged to an officers' club or a non-commissioned officers' club. And his job was to sort the cards, because we're going to play cards that evening and the children got into them. Look at the concentration. And he did that every day. He never said, I didn't do this, didn't I do this yesterday? So we gave a job for everyone. And again, we called it the club. And I also realized that most activity programs would go for, say, an hour, and then there'd be maybe a half an hour with nothing, and then another program, and then nothing. And when nothing happened was when everything happened. That's when people fell. That's when they went into other residents' rooms and went what I call shopping. This is when they would fall asleep. And so I developed this program called the Club that, as you can see from this slide, it was one activity after the other with no break in between. And we had some really wonderful things happening. Here we had fabric, and she was going to choose the fabric for the dress pattern. And I would ask her, every day, now, what fabric should I use for that dress? And look at her concentrate. And here they are, sorting cards. Everyone had a job. And if you notice, they had tags. So they could call each other by name, and they just loved that. They just loved that. And we had some wonderful results. We did some research, and as you can see, we doubled the hours of programming, and the best part was we increased the satisfaction from all staff, not just the ones involved in the club, and the families. And look at this, the decreased use of psychotropic medications. And look at the falls. So I thought, okay, that was cool. And I am now getting ready to retire. I was old then, that was 20 years ago. And I got called by the administrator. And he said, Joyce, you really need to come back, because no matter how good the club is, there are residents that just can't participate anymore. And I realized that they had advanced dementia. We kept them clean, we kept them fed, we kept them bathed. But I thought, that's existing, that's not living. You can see there's an activity on the side, and there she is, sound asleep. And we were also talking to families at this point about the futility of advanced medical care for people with advanced dementia. So we didn't want to do tube feeding or CPR, hospitalizations. So what we're saying to families is, let's not hospitalize. They can't participate in the club anymore. So the families were saying, well, Joyce, you're saying all the things that we can't do. Isn't there something that you could do? It's just so hard to give up. And I wanted to do something. So I thought, well, what I need to do is I need to develop a special activity program for people with advanced dementia. And I was looking for a name, and I wish I remembered where I read it. I don't know where it was, but anyways, it said Namaste, to honor the spirit within. And I thought, perfect name. So I hope that you'll see that every single aspect of this program honors the resident, honors the spirit within. And actually, it also honors the person who is offering Namaste. So there were people that were liking what I had to say, and they were kind of popping up. I was reading about Namaste Care programs all over the country. And I thought, I need to write a book. First, I wrote an article, and then I ended up writing a book. And I realized that you had to have some principles for it. So they had to be something so that if you did Namaste, that at least you had some structure to it. And the principles, I have two of them. One is the environment. People with dementia are so impacted by what's going on around them. So for instance, you want to make where they eat look like a kitchen or a dining room so that they get all those signals that that's where they're supposed to eat. One of the biggest problems we used to have was with the bathrooms. The shower rooms were so institutional that a person had no clue what they were supposed to do there. And then here's some stranger trying to take off their clothes. So in the good nursing homes where I was working, we made the bathrooms actually look like a bathroom that you would have at home, with a shower curtain that looked like that you would have in your own bathroom. So what I wanted for Namaste was I wanted it to be peaceful. I wanted you to feel calm as soon as you entered the room. One of the greatest compliments I had was when a family member told me when she walked into the Namaste room, she said, I feel like I'm being enveloped in a giant hug. So we turn the lights down, we play beautiful music, we use lavender or whatever is culturally or seasonally appropriate at the time. So the environment is very important in Namaste. And here's one of the rooms that we made. It was a day room, and we just added, kind of staged it for when Namaste was going on and made it look comfortable. And the second was the loving touch approach. And we know that people who work in nursing homes are so many times understaffed. They have to get, most of the residents now in a nursing home are full care, total care. So they've got to get 8, 10, sometimes 12 people up and dressed and toileted and into the dining room and fed, and they move and they move and they move and they move. In Namaste, nothing is done in a hurry. Everything is done with what we call the loving touch approach. There, the loving touch approach. And she was just taking her oxygen level, but look at, she's touching her and telling her what a beautiful lady she is. So basically, those are the two principles of it. A typical day, the resident, and of course they have their morning care and they're taken to breakfast and they prepare the room. And look at the sign that we made. Please enter quietly and gently, so that you didn't have a staff person coming in saying, oh, I need to get so-and-so, you know. It's just all done with this soft, loving way. And so And it's very person-centered. This is Betty, and her family told us that she lived on Cape Cod, Massachusetts, and she did lunch. And she never went out without her hat and her white gloves. So we asked the family members if they would mind sharing that with us. And so that we would, so that when Betty came into the room, she got her blue hat on and her gloves. We also wanted to make sure that our residents were not in pain. And this is a PAINAD scale. And actually it was developed by my husband. I married Dr. Ladislav Volitzer, who's Czech, which is why I'm in Prague right now. And he and his staff developed a PAINAD scale. And this was not copyrighted, so you can easily look this up on the internet. And they wanted a way to be able to scale pain for people who had advanced dementia. Because if you gave them the sad face and the happy face, oftentimes they'd be in pain and they'd point to the happy face because that's how they wanted to feel. So we used the PAINAD scale, and then we tucked everybody in. And everyone had their own quilt or Afghan, and we just snuggled them. So we just made sure that they were not in pain. They were in a reclining wheelchair or a lounge chair and snuggled down. And here's a resident that I wanted to show you how contractured she was. And we did the PAINAD scale, and there, we didn't leave her until she looked like that. The other problem that we have with people who have advanced dementia is they don't drink enough. And oftentimes they are hospitalized for urinary tract infections. So what happens in Namaste is once you're greeted and you're snuggled in your chair and we've assessed you for pain and I'm going to give you something to drink. And then the next person comes in and I greet them and snuggle them down and assess them for pain and give them something to drink. And then I go back to the first person and give them something to drink. We've had some wonderful results. Nursing has reported in some of the homes that they have no urinary tract infections with the residents that are in Namaste. So it's continuous hydration. There she is. And then we simply do ADLs, but we don't do them in a hurried way. Here's Janet, and she's wearing a company name tag somewhere around her waist, but she's got her name so that the residents can actually read it, because they can't read usually a company name tag that has the logo on it and it has your full job title and your full name. And look at her, she's just saying, oh, I'm so happy you're here today. You have such a beautiful skin. And we use Pond's cold cream. Pond's moisturizing cream jar has not changed since they started it, 40 years ago. And this was so funny. I showed the Pond's cold cream to this resident, and she looked at it, and I opened the top and let her smell it, and she went, oh, Pond's, I've used it my whole life, or I'd look like a prune now. There she is. And then, I never thought about men having their face moisturized, but I am smart enough to look at what the nursing assistants are doing because they are so knowledgeable. And she had taken just regular face oil, I think it was baby oil that she was using. And she put a little drop of allspice in it. So that was a scent that they appreciated. And she was doing the men's faces too, that also are very dry. And fussing with hair, I don't know. There's probably no other activity that I do that is more welcomed and more appreciated than just fussing with someone's hair. I'm now a hospice volunteer, and oftentimes I'm sitting with a patient as they're making a transition, and oftentimes I just fuss with their hair. And a couple of weeks ago, I was with a woman who was a friend, actually, and she was dying. And I started to fuss with her hair. and she had been very agitated, and her husband had asked me to come and do Namaste. So I had the scent, and I did the hand lotion or hand massage, and that didn't do very much to her. But I just fussed with her hair, and she turned around and looked at me and smiled and said, "I love you." So even if your hair challenged, you have your scalp massage. And this is an example of somebody whose hand is very contractured, and they wanted to clean it, but you're pulling that hand, trying to open it, but putting it in a basin of water and making like a waterfall with the water. And then you can dry the hand and you can moisturize it. And so you make an activity out of doing something so simple as just helping to clean and moisturize this person's hand. Now, this family said that she always wore lipstick. Every day she wore lipstick. So when she came into Namaste, she got her lipstick on. Whoop, there she is. A little surprised. And the nutrition, and as you can see, everything is just, sweet. At the end of this presentation, I'll be telling you that this is in 11 countries now. And so I went to Iceland, and I'm teaching, and I'm doing practically the same presentation that I'm offering you. And they said, "Oh, but we don't do puddings and we don't do ice cream." In Iceland, what they do is chocolate, little bits of chocolate and warm tea. So everything that you can do in Namaste needs to be adapted to fit the culture of the country that you're working in. And this was a woman that they brought into the Namaste room because she was driving everyone crazy. "I want to go home. I want to go home. I want to go home." So I gave her a lollipop. She finished it. "I want to go home." I gave her another. And within 2 weeks, she had stopped calling that she wanted to go home, and she didn't have to have a lollipop in her mouth all the time. She really got to enjoy the hand massages and what we were doing in Namaste. And here's some orange slices. And sometimes we just give them a friend, and we try to make them as lifelike as possible. So you can see this gentleman just, brushing this dog, and the staff is saying to him how lucky that dog is to have him for a master. He's taking such good care. I'm also a volunteer at the local veterans home, and the men in Namaste, they're all men. I have 8 men in the Namaste program, or at least I did before the pandemic. And I bought them all lifelike dogs, and I can get them at Amazon for less than $20. And what a difference it made. Agitation totally went away. These men just loved, petted, showed off the dogs, really made a difference in their lives. There are some women that like dolls, but I'm very particular. If a lady, well, and occasionally a man, really gets happy and satisfied holding a doll, I call the family and make sure that it's all right with the family. I don't want a family member to come in and think that I'm trying to make a child out of their parent. And so there she is. So basically that's what happens in the morning. And then late morning, what we want to do is we want to get them to wake up and get ready for lunch. So we play happier music, and we do some fun things. I say bring the outside inside. And it was snowing that day. It was in Massachusetts. And so I stayed with the residents, and the aide went out and got snow. But it were gourds in the fall. But you realize that many people with advanced dementia don't get out at all, or very seldom get out. So bringing the outside inside is part of what we do. So basically that's what happens in the morning, and everyone is thanked for being a part of the group and hugged or handshaken, whatever is appropriate for them. And Betty's hat gets put away and her gloves get put away. They're usually toileted and they're assisted with lunch. And then right after lunch, this is from IKEA, and it's just a cart, but I didn't want a nursing cart that you would, use to do care or pass medications. And we have all the Namaste supplies on it. So you can bring it to the resident's room. So I call it Namaste a la carte, and just bring it right to the bedside. And then in the afternoon, we might do videos. We had a wedding dress. This was actually the director of nurses. She brought her gown in and passed it around. I hope you can see the big smile on the residents' faces. So, and we do all kinds of things when we're doing reminiscence. We have military uniforms and hats for the men. We may have a bat, or in the UK, they'll have a soccer ball. So just different objects that may help people remember something that was happy for them, happy memories. And then in the afternoon, maybe we'll do their legs. We might do foot soaks in the afternoon. And again, we're playing beautiful music. We've got usually a widescreen video on of maybe, a garden, children playing, just something that would be very relaxing for them. And this, one of our Namaste carers decided he was going to give the ladies facials. They loved it, absolutely loved it. And an old-fashioned shave. When so many times you get men that are just frightened when somebody comes after them with an electric razor because they don't know what that means, and it makes a lot of noise. So in the afternoon, we try to do at least one old-fashioned shave for a male resident. And we do range of motion, but we do it to dance music, Let me call you sweetheart, I'm in love with you. And we're dancing. This happened in the UK. I was doing a hand massage, and a resident's mother was visiting. And so I said, would you like to give your mother a hand massage? And she said, well, yes, I would. And when I turned around a little bit later, the daughter was crying. And I said, what happened? She said, I'm massaging my mother's hand, and she looked at me for the first time in months and appeared to remember who I was. And she told me that she loved me. So teaching the families what to do, especially when they're visiting somebody with advanced dementia, because they really can't have a conversation. And so many times the families just don't know what to do. They just kind of sit there. So we have our families doing hand massages, and in areas where it's appropriate, we also have them doing the beverages, the continuous beverages. And the families start talking with each other. It's very lonely for many of the families where their spouses are in a care home and they live alone. And they end up making friends with other spouses who are living alone too. And that makes it a nice friendship group. And so in the afternoon, very little paperwork. And that's basically the day. And we just have had some wonderful, wonderful outcomes. We've had research that started in Australia, and now this one in Tasmania, many research projects in the UK, and a couple in the United States. And these are some of the clinical outcomes. And I especially like the decrease in use of the antipsychotics and anti-anxiety medication. That was really nice. And look at this one. Cool, huh? And this one. So basically that's the small group program. And then the COVID pandemic hit, and we were not allowed to do visits. And so we ended up bringing Namaste to the bedside, the new normal. But actually it had started in 2007 when Seasons Hospice was, one of their executives was attending a conference where I was speaking about the group program. And he asked me if I could put it in a bag. and bring it to the bedside. And I said, I have no clue, but I'd love to try. And I did. And so here we've got all the supplies. So we've got the Pond's cold cream, the Old Spice, we've got lavender linen spray, hand sanitizers. We've got everything in a bag that we take to the room. And you bring it wherever the person is, in a nursing home or in their own home, wherever they live, we can bring Namaste to the individual. And in the UK, where you stay in a hospital sometimes for weeks, they do Namaste groups in the hospitals. This person in their own home, the loving touch approach, we have the music, we do the lavender. And here's a hospice aide coming to visit someone in a nursing home. And again, that greeting, that's so important, just touching. And then we want to make the environment as quiet as possible. So we pull the privacy curtain, we assess her for pain using the PAINAD scale. And if she was in pain, we call the nurse. And I don't have a picture of the phone. Most of the aides now use a phone, but some of them still use a CD player because it can be louder. But we put on some music and we do the continuous hydration as we do in the small group. And we wanted to make sure that she liked the scent of lavender, and sprayed it, do the hand massage and her face, and we do the Pond's cold cream. And we just love her. We fuss with her hair. So everything that we do in the small group, we can bring to the person no matter where they are. And then a goodbye. And basically, that is Namaste. I'd be absolutely delighted if anybody had any questions and wanted to email me. It's joycesimard@earthlink.net. I've got a lot of videos on YouTube, which is a little scary. Some of them are quite old. And about 3 years ago, one of the care home owners in the UK decided to start what we call Namaste Care International. And we now have 11 countries offering this care. If you can imagine, I mean, I did a small group in Bennington, Vermont. I never, ever would have even dreamed that it would be international. We just had our third conference. It was viral, of course, on the 24th, but we had 100 people that listened in, and we had participants and speakers from all over the world. So please go check out Namaste Care International. There's a website, and I'm going to revise my book, hopefully in the fall of next year, and make it more international. It's offered on Amazon, and it's a how-to. So I hope if anybody would be interested in more information, go ahead and find the book on Amazon or Health Professions Press. And I have no idea what the next step is, because I wouldn't have dreamed this one. So thank you so very much for inviting me to be part of your